Okay. Good morning. My name is Annie Lindy Kugel, and I am the Executive Director for the Community Services Network. I'm excited to participate in the offering of the super important series offered by Care Oregon, and we're super grateful to have them here today. This is the second of the three-part series on the health-related social needs benefit. The first recording is located on our YouTube channel, which was sent out after the last session, is also available by clicking on the slide deck that will be sent out after this. And also you can just Google the CSN Community Services Network on YouTube and find the posting there if you missed the first one. The second one is obviously today, and then the third one is October 25th from 10 to 11 a.m. We do have a lot of content to cover today, so just keep that in mind. We definitely want to get to your questions as well. So if you do have a question come up, just feel free to put that in the chat, and Dave or Stephanie will try and get to those as we move through the slides. Okay, awesome. Go ahead and next slide. Okay, again, my name is Annie Lindy Kugel. I use she, her pronouns, and I'm the ED for the Community Services Network. And we have Dave Fife, the Director of Population Health with Care Oregon, Ifoma Moto, from the Director of Community Partnerships with Care Oregon, and Stephanie Ocher, the Population Health Portfolio Manager with Care Oregon. So thanks for being here, all of you, and excited to roll out this part 2 presentation. So our plan for today is to review information from webinar 1 about the HRSN, the health-related social needs benefit, to define housing, food, and climate supports that will be part of the HRSN benefits, and to discuss opportunities for CBOs to participate in the benefit and funding available to support capacity building. Questions from the webinar that we gathered from last time from all of you who submitted a survey. Super appreciate that. Housing benefit overview, eligibility, timeline, and implementation. Definition of at risk for homelessness. The referral process for the HRSN benefit, and Spanish translation for this webinar series. Those will be some topics that we'll be adding to this presentation today to answer the questions from last time. Next slide. All right, so does your organization provide one of the following: housing supports, food supports, or climate supports, climate devices? Next slide. So the benefit today is covering essentially whether CBOs might be interested or have the capacity to participate in the offering of this benefit to the Medicaid community. Next slide.
Great, thanks, Annie. The next slide gets us started into our review of the content. So Annie did pose the question if your CBO provides food, housing, or climate support. So if you want to let us know that in the chat, we're really interested to hear more about who's in the room and if your organization is already providing some of those services. But while you do that, we will also get started with our content. So we wanted to share a little bit of a review of what we covered in webinar number 1. For those of you who were able to join us, this will be a refresher. And for those of you who couldn't, we wanted to start with some foundational content about the benefit before we dive into some of the details. So first, we're going to start with reviewing what is an 1115 demonstration waiver. So each state holds a contract with the federal government that describes their Medicaid requirements and their specific state Medicaid health plan. Every 5 years, we have the opportunity to renegotiate the terms of our contract with the federal government. And that gives us an opportunity to ask for changes to our contract terms, including waiving some terms or adding new terms. So this 1115 demonstration waiver process, which you might have heard referred to just as the 1115 waiver or just the waiver, offers us a chance to test new approaches to providing and administering Medicaid benefits in order to test approaches to improve care, increase efficiency, and reduce costs. So Oregon has been participating in the waiver process since the 90s, but our most recent waiver was approved in 2022 and runs through 2027. The overall goal of the waiver, of our current waiver, is to advance health equity, and it includes a couple of different strategies to address health equity. The one we're going to be talking about today is that the most recent waiver introduces a health-related social needs benefit that will begin in 2024. The overall goal of the health-related social needs benefit, or we'll call it the HRSN benefit throughout this webinar, is to provide social supports to OHP members who are experiencing certain life transitions to help improve their health during and after these transitions. As a reminder, OHP stands for the Oregon Health Plan, and that's Oregon, the name for Oregon State Medicaid Plan. The HRSN benefit includes support for 3 specific health-related social needs, which are housing, food, and climate. The benefit will begin to be available starting next year, and it's going to roll out slowly over time over the next couple of years. So the first benefit that will be available starting January 1st of 2024 is the climate benefit. The food benefit will be available 1 year later on January 1st of 2025 for eligible OHP members. The housing benefit will roll out a little bit more slowly, starting with one population next November of 2024, specifically for OHP members who are at risk of becoming homeless. The housing benefit will continue to roll out over time to additional eligible populations, although the dates for that are still to be determined, but likely no sooner than 2025. So you can see that this is a draft timeline. During our last webinar, we talked a bit about how Medicaid is a partnership between the state and federal governments. And similarly, development of this benefit is a partnership. So we still need approval from the federal government for our plan, including this timeline. And a lot of the content we're going to be discussing today, similarly, is still being reviewed by the federal government, and some of it might change over the coming months. So I mentioned that the benefit will be available to certain populations. So we wanted to review that eligibility criteria before we start discussing the benefit specifically in the services available. There's a couple of different layers of eligibility that individuals will need to meet to access these services through the HRSN benefit. So the first one is that individuals will need to be a current OHP member. This is a benefit that's being provided through Medicaid, so that membership is the first step. We mentioned as well that this benefit is really focused on helping support individuals experiencing life transitions. So that includes this list of transitions here. Youth involved with the child welfare system, including youth leaving foster care, people experiencing homelessness or at risk of homelessness, people released from custody or residential behavioral health settings, people transitioning from Medicaid only to both Medicaid and Medicare coverage, which we sometimes call dual coverage, youth ages 19 to 26 with special healthcare needs. And then for the climate benefit, there's an additional population, so people living or different additional transition, which is people living in an area experiencing an extreme weather event. So to be eligible to access this benefit, OHP members will also need to be experiencing one of these life transitions. We also have a couple other criteria that individuals will need to meet. So individuals will need to have a social health need. So they will need to have a need for food, housing, or climate support. And they will need to have a clinical health need as well. So some of the criteria for which clinical health needs qualify for support is still in draft format and being reviewed. But examples will include things like complex physical health needs, such as autoimmune conditions or cancer, mental health conditions, pregnancy, and then age is also currently one of the draft criteria. So children, young children and older adults. So what this will look like in practice, we know this is a lot of eligibility criteria. So, but if we think of an OHP member named Anna, we can talk through this criteria. So Anna is a current OHP member who's 35 years old, and she's currently pregnant. She recently received an eviction notice saying that she's about to lose her housing because she hasn't been paying her rent. So she's in need of housing support. She would qualify for this benefit because we know she's a current OHP member. She's at risk of homelessness, which is her life transition. She has a social health need. She's in need of housing support. And she's pregnant, so she has a clinical health need. Okay, some of the benefits will also have some more specific eligibility criteria, but we'll talk about that in a little bit. First, we wanted to take a closer look at what these life transitions mean and what the definitions are, because we know that some of these terms are a little bit vague. So when we're referring to youth involved with the child welfare system, what that refers to is individuals who are currently or have previously been in foster or substitute care, are receiving adoption, guardianship, or family preservation services, or are the subject of an open child welfare case. When we refer to people experiencing homelessness or at risk of homelessness, that's really referencing those definitions that in alignment with HUD's definitions. So we have included a link to that at risk for homelessness definition here. I know we received a couple of questions during our last webinar about it. It does have a couple of different layers of kind of eligibility that you need to meet. So we definitely recommend reviewing that if you do work with this population. For people released from custody or behavioral health residential settings, what that includes are transitions out of jails, prisons, residential facilities, and the Oregon State Hospital. And individuals experiencing this life transition will be eligible if they've been discharged from one of these settings in the past 12 months. People transitioning from Medicaid only to dual coverage includes current OHP members who become eligible and transition to dual Medicaid and Medicare coverage, either because they've become eligible for Medicare due to age or disability, and they will be eligible to receive support through this benefit 3 months prior to that transition and up to 9 months after that transition happens. And then finally, youth ages 19 to 26 with special healthcare needs is a term that's still being defined. Right now, there's some draft criteria, but it's pretty complex and includes a couple of terms that don't have complete definitions yet. So this population will start to be eligible in January 1st of 2025 because there is a little bit more work that needs to happen to really define what that means. During our last webinar, we also talked a bit more about the role of CCOs or coordinated care organizations, just generally, but also in relationship to this benefit. So we talked a little bit last time that CCOs have memberships. They help coordinate and manage the health benefits and the Oregon Health Plan benefits specifically for members across the state. And that will be similar to how the HRSN benefit is managed as well. So all CCOs across the state, you can see the map here of the CCOs, they will all participate in the benefits rollout and are currently working to build new systems, processes, and networks to support benefit implementation. So during the second part of our webinar today, we're going to talk a little bit more about the role of community-based organizations or CBOs in the benefit and some of the different ways that your organization might be able to participate. Some of those potential ways are things like informing the community about the benefit, helping community members determine if they're eligible to receive support, which could include completing screening on their behalf, or directly providing housing, food, and climate support that will be reimbursed through the benefit. So before we get into those roles, we're going to next do a deeper dive into what's covered through the HRSN benefit, but we wanted you to start thinking about what your organization might be interested in and the ways you might be interested in participating, especially as we go through the specific supports that will be available, so you can think about how that relates to the services you already provide. Okay, so let's take a closer look at what we mean when we say housing, food, and climate support. We'll start with the climate benefit and defining what's included. So the climate benefit is really meant to mitigate the impacts of climate on health through providing a couple of different climate devices that help support health outcomes. So that includes medically necessary air conditioners, heaters, air filtration devices, personal power supplies, and refrigerators. The benefit will both cover access to these devices and will also provide support for device installation. The eligibility for the climate benefit reflects what we talked about a little bit earlier. Individuals will need to be an OHP member to access this benefit. They'll need to be experiencing an eligible life transition. With this benefit, individuals who are living in an area experiencing an extreme weather event will also be eligible, which could kind of take the place of experiencing that eligible life transition. And then these are medically necessary devices. So individuals will need to have qualifying clinical health needs, and they will need to have a health condition that will be aided by one of the available devices. So there will be clinical criteria established for each of the devices that really helps us better understand what we mean by medically necessary devices. The clinical criteria is still in draft format. It's still being reviewed. So some of this might change, but we wanted to provide some specific examples below of what we mean by medically necessary devices. So this is definitely not a complete list. And again, this is draft, so it might change. But for air conditioners, we know that certain health conditions put you at greater risk for poor outcomes with extreme heat or sustained heat. So examples of eligible conditions would include chronic cardiac disease, diabetes, or pregnancy. For heaters, we know that asthma and COPD are connected to poor outcomes if you don't have adequate heating in your home. Infants will also be eligible. We know that being an infant isn't a clinical health condition, but we know that infants are at higher risk if they don't have proper heating in their home. So they will be eligible as well to receive heaters. With air filtration devices, example health conditions that will be eligible include COPD, asthma, allergies, and individuals who are immunocompromised, such as having cystic fibrosis or cancer. And then personal power supplies are really designed to help individuals who use durable medical equipment, such as breathing machines, feeding pumps, or power wheelchairs, because we know in the event of a power outage, those individuals would be at really high risk of poor health outcomes if they weren't able to use their equipment. So the personal power supplies will help ensure that durable medical equipment can continue to be used even in the event of a power outage. Refrigerators will be available for individuals who have conditions that require refrigerated medication. So some examples are diabetes, asthma, or Crohn's disease for individuals when they do have medications that need to be refrigerated. Okay, so let's take a closer look at the housing benefit next. There's a couple of different services that will be available through the housing benefit, which include rent and temporary housing assistance for up to 6 months, utility assistance for up to 6 months, pre-tenancy and housing navigation support, tenancy sustaining services, deposits and one-time moving costs, and medically necessary home accessibility modifications. As we briefly talked about earlier, the housing benefit's going to roll out slowly over time, starting with one specific population that will be eligible in November of 2024, which is individuals who are at risk for homelessness. The other life transitions that we talked about earlier will also be eligible for housing benefits, but we just don't have a date yet for when that eligibility will begin. A couple of the benefits do have more specific criteria for eligibility, but we'll talk about that in a minute. Individuals will need to have a qualifying clinical health need to access the housing benefit, and they will need housing support as their kind of social health need. So either that could be obtaining or sustaining housing or creating an accessible and healthy home environment. So we'll take a closer look next at these benefits, starting with rent assistance. So rent assistance will provide payment for up to 6 months for a variety of types of housing. That will include apartments, single or multifamily homes, single room occupancy units, ADUs, mobile home communities, trailers, or manufactured homes. It will also include short-term motel or hotel stays and transitional and recovery housing. As we mentioned, this kind of similarly, rent assistance will begin to be available to individuals who are at risk of homelessness, meeting all the other HRSN eligibility criteria in November of 2024. Rent assistance, though, is one of the benefits that does have more specific and more limited eligibility criteria. So when the benefit is fully available in the future, there will be a smaller set of life transitions that qualify. So in addition to at risk of homelessness, individuals who are experiencing homelessness will qualify, OHP members transitioning out of institutional or congregate settings, and youth transitioning out of the child welfare system will all qualify. Utility assistance will include payment for up to 6 months for utilities, which includes water, gas, electric, internet, and phone services. And this benefit will be available to both support payment for the actual utility for that service itself, as well as setup costs for the utilities, payment to resolve unpaid utility bills, and costs to restart utility services that were shut off. The eligibility for utility assistance is really tied to rent assistance. So individuals who are receiving rent assistance will also be eligible to receive utility assistance. The benefit will also provide tenancy sustaining services, which are services designed to assist members or individuals in maintaining housing stability. This could include things like communicating with an individual's landlord on their behalf and advocating for their needs, providing training or resources to an individual to support them to understand their lease and adhere to the requirements within it, developing a housing support crisis plan if an individual's housing is jeopardized, so working with them on that, helping support them to develop independent living skills so that they can be successful in housing, or supporting individuals to access other supports to help them stay housed. So that could include things like income or other benefits to help them with paying rent, for example. This benefit will begin in November 2024, like the rest of the housing benefits, focused on individuals who are at risk for homelessness. And when the benefit is fully available, all individuals who are eligible for the HRSN benefit, including that entire list of life transitions, will be eligible to receive tenancy sustaining services. So tenancy sustaining services are really designed to help someone keep their housing and be successful in their housing, but the benefit will also provide support for pre-tenancy and navigation services. So this benefit has some similar activities, but it's really designed for individuals or households who aren't currently housed and need housing. So some of the activities that are included in this benefit are things like developing, reviewing, or modifying a housing plan, helping that individual or household search for housing, which can include support for completing housing applications or enrolling in the local continuum of care's coordinated entry system, supporting move-in details, such as confirming a unit is safe and ready for move-in or coordinating some of those move-in logistics, and again, developing independent living skills and connection to other stability supports like income or benefits. So we can think of this as a lot of types of services that a housing navigator or housing coordinator might be working with an individual or household on to obtain housing. So this benefit will become available for individuals at risk of homelessness starting November 2024. And in the future, when the benefit is fully available, all individuals eligible for the HRSN benefit will be able to access this service. So we talked about rent and utility assistance earlier, which provides support over 6 months, but we also will have another benefit called deposits and one-time moving costs that is really focused on those one-time costs to help someone obtain housing. So these are those short-term one-time expenses really related to that transition. So it might include things like deposits to secure housing, so a security deposit or paying for some last month's rent, setup fees or deposits for utilities and the first month's utility expenses, one-time cleaning or pest eradication before move-in, moving and relocation expenses such as a moving truck, or purchasing household goods, furniture, or stocking someone's pantry if they're moving in and don't have the things they need to be successful in that housing unit. This benefit similarly will begin in November of 2024 for individuals who are at risk for homelessness. And in the future, all individuals eligible for the HRSN benefit will be able to access this support. Okay, our last housing benefit on the list is medically necessary home repairs. So this benefit will include home modifications that eliminate home-based health and safety risks, which include things like accessibility modifications, such as ramps, rails, or pathways to make the unit more accessible, home remediation services such as carpet or mold removal, or weatherization services. So this benefit will begin in November 2024, again, focusing on individuals who are at risk for homelessness. And in the future, any individual eligible for the HRSN benefit all those life transitions will be eligible to receive this support. This benefit does have medical necessity criteria. So similar to what we discussed for the climate benefit, where there were specific health conditions that kind of showed the medical necessity of those devices, there will be criteria similar to that developed for this benefit. Okay, so last we're going to talk about food benefits. Food benefits will include nutrition counseling and education, medically tailored meals for up to 6 months, meals or pantry stocking for up to 6 months, and fruit and vegetable prescriptions for up to 6 months. The eligibility requirements for this benefit, again, reflect what we've been discussing today. So OHP members will need to be experiencing an eligible life transition, be experiencing food insecurity, and have a qualifying clinical health need. Similar to housing, there's a couple of food benefits that have more specific eligibility criteria, but we'll discuss that as we go through the benefits. And food support will begin to be available starting January 1st of 2025. So the first benefit on the list is nutrition education. And this is really education designed to help individuals or households or families make food choices and adopt food behaviors and nutrition behaviors that support health and well-being. So this, in other words, can include things like nutrition classes or cooking classes that help people make decisions about food and nutrition. In January of 2025, any individual who's eligible for the HRSN benefit and meets all the criteria we've been discussing will be able to access nutrition education. Medically tailored meals will also be available through the HRSN benefit, and this includes meals and meal kits that will support individuals with health-related conditions. So the benefit includes an initial assessment with a registered dietitian to help make that individualized plan based on the individual's health needs. And then it includes up to 3 meals a day for up to 6 months for the individual. And it will include regular reassessment to determine what that individual's needs are at least every 3 months. This benefit will be available starting January in 2025 for any OHP member who's eligible for the HRSN benefit and is experiencing an eligible life transition. And similar to a few of the benefits we've talked about, because this is medically tailored meals, there will be specific clinical health criteria that will be developed. Meals and pantry stocking will include up to 3 meals a day for 6 months. This benefit can be provided for an individual or at a household level. The meals will be required to meet nutritional guidelines and food safety standards and should be culturally appropriate and consider dietary preferences. This is one of the food benefits that does have more specific eligibility criteria. So when this benefit becomes available in 2025, it will be offered for individuals who are both experiencing one of the eligible life transitions we talked about, but then also will need to meet some additional criteria, which is really specific to this benefit, which is children under 21 years old, individuals meeting that youth with special healthcare needs definition that's still in development, or pregnant individuals. So OHP members will need to both be meeting that eligible life transition definition and one of these 3 conditions to access this benefit. Okay, the last food benefit on the list is fruit and veggie prescriptions. This includes up to 6 months of support to purchase fruit and veggies from participating food retailers. So it can include purchases at grocery stores, farmers markets, or farm stands, or community-supported agriculture CSA shares. When the benefit goes live in January of 2025, any individual who's eligible for the HRSN benefit and meets eligibility criteria will be able to access this benefit. Finally, we wanted to talk a little bit about outreach and engagement support that will be available through the benefit. So there will be resources available to support outreach to individuals who might be eligible for the benefit to help inform them about the benefit and screen them for eligibility. Many of you already are doing a lot of outreach and engagement type work, but this service is really designed to be specifically about connection to the HRSN benefit. The expectations and guidance for this benefit are still under development. So we don't have a lot of information for you today about this benefit, but there will be more information to come. We do know that outreach and engagement support will be available to help with connection to any of these benefits, climate, housing, or food. Okay, so we're going to pause here for questions, but while we do that, while we check in on questions in the chat or other questions coming in, we did want to hear from all of you. Just thinking about this list of benefit services, we're curious to hear how well these benefits reflect the type of support that your organization already provides. If you can let us know in the chat. 1 would be not at all, this isn't what we do at all, and 5 would be this describes very well what we do. It's a close reflection of the support we're already providing. So if you can let us know that in the chat, we will pause here and check in on questions. Annie, how are we doing on questions or anything?
Great. Dave's been doing a great job answering the questions in the chat. There are a few outstanding questions. 1, do these food benefits through this program make participants ineligible for EBT? It's one question.
The answer is no, they don't make us ineligible for EBT. In fact, the benefits are meant to complement and not replace EBT, WIC, any other kind of federally or state provided food benefits. Great question from Amelia.
Awesome, thank you. And yes, we will share the PowerPoint afterwards, the slide deck in the follow-up email. So that will be there for you as well as the recording. And then it looks like that one was answered. Awesome, Dave. Thanks so much. And great questions, everyone. Super great questions. Okay, it looks like another one. Question 1, is there an annual dollar cap to the amount of assistance provided per individual? And 2, if one has multiple environmental needs, are you able to submit for more than one need under that category? And 3, with current CCO flex funds, will this go away, or will the 1115 waiver supplement these funds?
These are great questions from Liz, and I think Liz answered all other folks' questions too. So number 1, no dollar cap. There are the benefit definitions themselves that kind of provide some structure to the benefits, but there is not an annual cap or anything else that's contemplated right now. The best way to think about this benefit is that we're trying to learn how it could work. So we're at a really cool spot that the federal government and the state government have kind of put together these funds that we are able to use to learn more about this and try to see what it actually takes to help someone get their social needs met and stabilized in the way that helps them get outcomes. So no dollar cap currently. If someone has multiple needs, absolutely. We're working on how that flow looks and kind of gets as simplified as possible so that but the way it should work is that a CCO receives all of a screening that allows them to understand what are the full spectrum of needs, and they're able to authorize all of them that the individual qualifies for at the same time. So you could be working on both housing and food needs at the same time with some confidence that will be reimbursed. And then finally, really important question, flex funds are not going away. And so a lot of these questions around, well, what if someone doesn't quite meet this criteria? What if someone is healthy but still, that doesn't have that list of chronic conditions but still needs something? What are our options? We're so lucky that for the last decade, we've had access to flex funds to meet those kind of needs at CCOs, and your local CCO will still have access to flex funds as a tool to use to meet the social needs of the individuals and folks that you care for that are OHP members. So not going away. And in fact, for Care Oregon supported CCOs, we're thinking a lot about how these two programs are unified and can be brought together more closely to have a real outsized impact on the health of our communities.
Awesome. Thanks, Dave, so much. And then looks like Laura had one more question. Will there be implementing a process to repeat outcomes of those exiting the housing program? Like if people stay in housing after the last payment is made at 6 months, 12 months, and a housing inspection process to ensure the housing is appropriate, safe, similar to how normal housing programs operate? And will there be accountability measures for those contracting with the program?
Yeah, I think these are a lot of great questions. There's one theme to this that I think also applies to a couple of other questions, is that one of the reasons that we are starting this conversation is because we have a lot to learn as CCOs around what the best practices are. So I might not be able to speak to what the exact terms are in terms of service provision between your programs and your local CCO. I think those are the exact kind of questions that we are asking. I think you can go with some confidence that there's number one, there's going to be level of reporting and accountability that's associated with this, mostly in terms of did an organization provide high quality services like they said they would. When it comes to coordinating, beyond those 6 months, that's also a set of questions that we're thinking through. And I know many CCOs are working with their coordinated entry systems in their local areas to try to think through, hey, what does this look like after 6 months, and how do we bridge this to other existing social supports so that there's not that drop off, but there is a continuous level of support in a way that is cognizant of different supports, different systems in the housing arena. Accountability measures for those contracted with the program, that will likely be a function of an eventual contract that an organization can sign with its CCO. So can't speak to the local needs there, but I think it's something that should be expected.
Great, thank you. And then we'll just take Stephanie, do you think one more question right now, and then we'll follow up with the others? Okay. So would OHP provide cooking classes for single person households in a group setting in our building, like a group cooking class? So essentially, would the funds be able to pay for cooking classes? Okay.
I think it's a great question, and because food is a little bit further off, we're still, I think both the Oregon Health Plan and CCOs are still kind of talking around what are the details beyond that level that Stephanie shared. But this kind of concept of nutrition, counseling, education that you saw as one of the listed benefits might include something like that. In fact, I think it's very likely that it would. But we still don't have quite the level of detail for the food that we do have for, say, the climate devices that are coming up first.
Perfect. Awesome. Thanks, Dave. Okay, so we will definitely follow up with these questions either at the end or in our follow-up, just so that they will be answered. But we do kind of need to get moving along to the next part. So Stephanie, I'll let you take that, or maybe it's Dave at this point.
Yeah, so I love these
Awesome,
questions, right? Because they are really speaking to what we wanted to end our webinar with, was just to start to talk to you a little bit about, like, what are some roles that your organization might have in rolling out this benefit, with the full recognition that while we're speaking specifically to a benefit, this is maybe a piece of the broader work that your organizations do in the community. So what is potentially a role here? So our first slide here is just to help you kind of think through what are the different roles that an organization might play. So first off, you might be thinking, I'm not sure where I fit in, and it might depend on what your organization is ready for, and you might not be ready actually to participate in any of these ways, but we want to give you some ideas just to get you thinking. So you might be able to share about the benefit. A benefit that no one knows about doesn't help anyone. So there's definitely opportunities to share in communities more about that. You might be able to support the benefit by helping to screen and navigate, help people get their eligibility checked and get the right information in the right places to open up those doors of support. Or your organization might actually be specifically providing the services that Stephanie just described over the last couple of minutes. So let's actually dive into each one of these a little bit more, so you can kind of get a sense of, hey, maybe we fit here or somewhere else. So we know that it's really important that people have access to information in order to access these benefits. And so CBOs provide an incredibly important role in sharing, whether it's in community engagement events, one-on-one discussions, information that you're sharing. And so there are a host of ways that organizations could be helping bring awareness to these benefits. So I'm going to introduce a question here and repeat it several times because we want you to be thinking about how you might fit in specifically as your organization. So we can anticipate that some of the things that you might need to be a sharer about this benefit include having access to some of the detailed information like what we've shared today, and likely several layers deeper of detailed information so that you feel confident in what you're sharing with your community members and the relationships that you built through trust. What we want you to start thinking about as we go through this section, if you chose to participate in this portion of the benefit, what would you need to do it successfully? What else might you need beyond just that detailed information? The second way that you could potentially support this benefit is in helping to screen for eligibility. So I'm going to draw your attention to the right side of the screen here, because in basic terms, at some point, someone's going to need to help an individual or a family answer some questions and gather some information around their eligibility. Stephanie shared some of the types of information that will need to be collected. And we'll need to send it to the CCO, the Coordinated Care Organization, so that they can get it authorized and greenlit to provide that benefit. So who will do that? Well, maybe it is your CBO. We want to provide a lot of opportunities for people to access this benefit. There is not going to be a single pathway to doing so. So CCOs are going to be working with lots of different organizations to enable this screening and access and identification of needs. And so what that might entail is determining if somebody is a member of the Oregon Health Plan, figuring out what CCO they might have coverage under, assessing and confirming that they're in a life transition population, and even recommending what the services might be that the person should be able to access. As you can imagine, if you were in the role of a screener, we know that you will need things like the ability to check on someone's eligibility, the ability to transmit or communicate or partner with a CCO. So we're interested as well, beyond those elements, what else you might need to participate successfully in supporting screening for individuals. And last but not least is the amazing work of actually meeting these needs. So there's communication, there's collaboration with the CCOs in screening, and then there's the actual provision of services. So what you see on the screen here are a number of attributes or qualifications that we will be expecting as CCOs of our partners that provide these services. And as you look at these boxes, you're probably going to see certain things that you say, we bring that day one to the table. And you might see some qualifications that you're less comfortable with. And you say, we might need help in meeting this qualification if it is an expectation of a service provider. So everything from having strong community relationships, which I imagine all of your organizations do, to maybe receiving closed loop referrals for services might be a new one that you need to explore and understand better as you assess whether you would want to be an organization that provides HRSN services. So there are a number of elements that we could talk about here, but we're going to dive into just a couple examples so you can start to get a little bit more information around what do some of these things mean as provider qualifications. So first off, I want to talk a little bit about the requirement to provide culturally and linguistically appropriate services. So Medicaid and CCOs as well have a strong history and a significant set of requirements to make sure that everybody can access care in a culturally specific way and in a language that is theirs and that they understand and can communicate in. You likely bring cultural appropriateness to the work that you do every day, but if you're worried about how do I give linguistically appropriate services, it's worth noting that CCOs and Medicaid members have access to interpretation services. So just like a member of the Oregon Health Plan might need an interpreter in a medical clinic and get that support from their CCO, the same service may be available in community settings as well from your local CCO. So there's an opportunity to collaborate to meet that particular qualification. Similarly, there's going to be requirements around reporting and oversight. And I think it's really important to just kind of think through what are the whys behind these type of requirements, so that you can kind of assess whether you're able to meet them. So why do we have reporting requirements for a benefit like this? Well, we have to tell a story. We need to make sure that we are proving to the state and federal governments that we are impacting individual lives, that we're using the funds in a way that actually impacts individuals and communities. So reporting is all about information and telling the story. And there's oversight requirements as well that ensure the privacy and the safety of individuals, and that ensure that important funds are spent in the right ways and for ways that serve people. And so there's going to be reporting and oversight requirements. And what that might look like in the day of the life of a HRSN service provider is documenting some specifics about the engagement or the action taken for an individual. So who and what. So who provided the service, or who was served, what was done to support them, and when and where it took place, and what was the reason for it. And there may be elements of just tracking eligibility, saying, or tracking that the authorization of what services were approved and when. And there might be requirements related to making sure that the individual's information is kept private, that it's not available in a place or a site where individuals could access it in a way that harms the individual or their privacy. It may involve participating in annual audits, as just going through some of that documentation that was mentioned earlier. And it might be verifying that certain checks were in place to make sure that we weren't duplicating any benefits. Administration of this sometimes is not people's favorite or most fun aspect of this, but there are reasons for it. And so what we wanted to do really is just give you a little sense of what might be in the future for organizations that provide these benefits. So you can start to ask questions about how might we do that, and that's where we want to get to today. The last two provider qualifications are also really important, and one is your ability to invoice for services provided. So if you're supporting individuals through this benefit, we want to make sure that you are able to be reimbursed for those services. And so the ability to invoice your local CCO is really important. So one way this might happen is once the CCO has authorized or given permission to provide that service, your organization might provide and document that service and then submit an invoice to the CCO for the services provided and be reimbursed for the efforts there, both for maybe for the pre-tenancy services that you provided or the pantry stocking that you did. But there's also potentially flexibility to work in a different way, where because maybe you're worried about cash flows or your ability to front the funds or the staff to do a particular activity, you may want to engage your CCO on how to be paid in advance for services. And so that would look a little bit differently, where there are funds available to your organization up front. And then once the service is authorized by the CCO and you've provided and documented it and then submitted an invoice, it's a reconciliation process of making sure that the funds were spent in a certain way and not a reimbursement process. So something to think about as you think about ways that invoices and invoicing a CCO might look at your organization. And the final requirement I want to touch on just briefly, and we're happy to answer a lot of questions, is that interesting requirement of being able to receive a closed loop referral. So it's really important to define the really broad way that this term closed loop referral is intended in the benefit. So this is really about communication back and forth. So it's not a requirement to use a particular platform or a particular technology, but it is a requirement to make sure all the parts of the system are talking to each other. So if a referral is sent in some means, making sure that the referring person gets the feedback that a referral is accepted, or maybe in some cases not accepted. It's making sure that if somebody is asking an organization to provide service, that organization is communicating back and saying, we will absolutely be providing this service, or we have some questions before we can provide the service. So there's will be a requirement to essentially communicate in that way through a closed loop, with organizations like the local CCO that might be requesting these services. And that might use your local community information exchange, but it could also involve using emails or faxes or even mail in some cases. As we kind of close that out and we start to think, and you've been asking yourself that question, if I were sharing information, if I were a screener and collecting information and communicating it, or if I was providing services, what might my organization need to do that really well? You've been asking yourself and you've come up with a list of things that you might need. This is the good news part of the presentation. So there's a generous amount of funding available through the waiver to provide support for the kind of infrastructure that is needed here. So it's $119 million that is a fund for the entire state and for the entire duration of the waiver. But $119 million is not a small amount. And it's intended explicitly to support community-based organizations to meet some of the needs that we just described here. So if you were thinking about, for example, service provision, and you thought, we have some technology needs. If we're going to be asked to document or to invoice, we're going to have to think a little bit differently about how we use technology, or we're going to need some help around how to develop business practices, or we might need some support in workforce development, or we would love to do some of the outreach and communication, but we just don't have the funding to print the materials or distribute the materials. These are all things that your local CCO is going to want to know, because they're going to receive a portion of that $119 million to support local efforts to build that infrastructure. So a couple of examples of how that funding might be is for software, or for even modifications of existing data platforms or software. It might be related to developing some of the business processes or procedures, or bringing in the needed training for your organization's staff to prepare them for some of the requirements of this benefit. But it could even be getting a head start on funding your staff, recognizing that you would love to meet these needs, but you need more people in your organization in order to do that and to continue the work that you're doing right now beyond the benefit. And so there's opportunities to request funding for the initial period of bringing on and training the staff positions that will be crucial to providing some of those services. Or you might have a vision of incredible outreach events that you feel like you can put together that maybe allow you to communicate and maybe screen for eligibility. But you need funding to secure the premises, to bring together the materials and the community members that are needed. Those are all examples that we'd love for you to start thinking about as we prepare to have this infrastructure funding available. And we hope to have it soon. It's not there yet, so you do have time to start to think deeply about what might be needed for your organization to be successful. And with that, I think we have a final period for questions in our last few minutes.
All right. Thank you so much, Dave. It looks like really the majority of the questions this round have been answered, except for, oh wait, no, that was just talking about the extension. And then if the slide deck will be shared, which it will in a follow-up email, I think that's pretty much, oh wait, there's one more. How will screening assessment of these requests be done to ensure that the specific need is not one that is billable through their insurance? Sorry, some things over that. On medical necessity, based on medical necessity. For example, under climate, personal power supplies funding power wheelchairs.
Liz, I might need more information for that one. I'm guessing what you're asking is, if something is a covered benefit already through Medicaid, how would we know that? And how does that work on the screening? And my answer to that is that those are the types of questions that we want to make easy behind the scenes for you. So as your organizations are identifying needs, your local CCO is finding out the best way to meet those needs, whether it's funded by this benefit, funded by an existing medical benefit, or some other program. So that's my best answer there, and please correct me if I misinterpreted the question.
Awesome. Thanks, Dave. And I think the last one, we'll be talking a little bit more about it next time. Is that correct, Stephanie? I think so. Yeah, awesome. So more to come on that. And we will go through the notes. I want to be mindful of time. We'll go through the notes in the chat just to make sure we have everything for everyone answered. And next steps is that we will host the final one on October 25th from 10 to 11. That is the same day as the Nonprofit Connect. So we have we will be filling your day that day, which is awesome. And it's going to be a great last presentation and more opportunities for asking questions, clarifying questions. Just want to thank Dave and Stephanie so much for presenting, and IFOMA for being present to answer questions. Super appreciate all of you and this opportunity to share this with the CBO community. Thanks for attending. And again, we'll send a follow-up survey. So please feel free to put your questions in the chat there. All right, and here is the survey. If you have a second to fill it out, I just posted it in the chat. All right, I'm going to stop recording. Thank you very much.